From high atop Healthcare Hill in Central Maryland, this is BSN Headline News. Today's top story is Bon Secours Health System teams up with Mercy Loan Fund to loan the Better Housing Coalition in Richmond, Virginia, $500,000. Yes, thanks to a $500,000 loan and an extended line of credit from Mercy Loan Fund and Bon Secours Health System, the Better Housing Coalition in Richmond, Virginia, will be able to expand its development of high-quality, affordable workforce housing in the Blackwell neighborhood. For details, let's hear what Bon Secours Director of Community Commitment and Social Investment, Ed Gerardo, has to say.
I'm Ed Gerardo, and I serve as Director for Community Commitment and Social Investments. As we've heard, the Bon Secours Health System uses a portion of our investments to do community investing through low-interest loans. And a good portion of that, I would say, has been lent to organizations that do low-income housing and affordable housing. We're particularly fortunate that we have a partner in the Mercy Housing, and they have an investment or a lending arm called the Mercy Loan Fund. So the Mercy Loan Fund extended a line of credit to the Better Housing Coalition in Richmond, Virginia. Coincidentally, Bon Secours Richmond Health System has worked with the Better Housing Coalition in the East End of Richmond, both around our Healthy Communities work and in the restoration of housing in the East End, which will go to low and middle income people. Well, since we were able to place additional monies with the Mercy Loan Fund this spring, the Mercy Loan Fund has extended a $500,000 or $500,000 line of credit to the Better Housing Coalition, who can now use those funds to initiate development of a project in Blackwell, which is a neighborhood south side of Richmond City. These are the types of things that can only be done in a collaborative way. So you have three entities: the Better Housing Coalition, who's on the ground, able to do housing renovation and can identify individuals that will qualify. You have the largesse of the Mercy Loan Fund, which can extend the line of credit because ultimately the mortgages will be picked up by the Richmond Redevelopment Authority, but the construction and renovation has to be funded in a different manner. So the Mercy Loan Fund is line of credit will make that happen. And then the Bon Secours Richmond Health System and the Bon Secours Health System are partners in making the Mercy Loan Fund work in a way, particularly in our own communities. The reason Bon Secours does this is it flows right out of our mission and our strategic quality plan. You know, the new SQP right off the bat says, bring communities to wholeness. And it's great that we have individuals in our mission departments. We have outreach services like our caravan, our dental vans, our ministries, both from Bon Secours, New York, all the way to Bon Secours, St. Petersburg, that are out in the community doing great work. But it's particularly wonderful when we can take a portion of our financial largesse and make that available to our communities. So we're getting a twofer on this, and we're particularly happy about that.
With this new funding, more than 60 individuals and families at or below 80% of the area median income, which, by the way, is $60,500 for a family of four, will be able to purchase their first homes. Bon Secours defines healthy communities in our SQP as a good place to live for all residents. The Blackwell community now has a greater chance of that happening thanks to Bon Secours' mission of being good help to those in need. Next week, we'll talk to Ross Darrow, Director of Treasury Services, to get a better perspective of the Treasury's role in socially responsible investment. In other news, Bon Secours is changing its password policies. As we increasingly rely on computer systems to enable the work we do for ministry, it becomes equally important to ensure our systems remain secure. And security, whether it's our patients, residents, or employees' privacy, or Bon Secours' information, starts with solid password protection. So, we are changing the minimum requirements for passwords to access BSN systems. But don't panic. is fairly straightforward and easy to do. First, the next time you are required to change your password, and as you know, passwords are already required to be changed periodically. The minimum length will be 8 characters. Then, beginning March 2013, all passwords will be required to be complex passwords. In other words, passwords will be required to contain 3 of these 4 elements: uppercase characters, lowercase characters, numbers, and/or special characters. Many folks already use these complex passwords as they are pretty much industry standard, but if you are not already using them, you will be required to use them beginning March 2013. Also, if you are not already using complex passwords, you should consider starting now on all your passwords, BSHE or not. It's easy to change your BSHE password. Just hold down the Alt-Control-Delete keys, then choose Change Password. Or you can always email EISSC at the email address on the screen. And remember, Security Sam says, security is everyone's responsibility. Passwords are the key to security and privacy. Finally, in our continuing series to bring the SQP to you, today CEO Rich Statuto talks about providing extraordinary care.
The second is to ensure our care is extraordinary. We want to optimize our patient and resident experience. There are so many indicators that we could measure here, and our quality team, our clinicians said, you know, the best one would be, which is a catch-all for everything that we do, is would the patient and their family recommend Bon Secours to their family and friends? We want to be in the top decile and strive to do that over time. When someone answers that, they're looking at how was the quality of care, the communication with the clinicians, how was it? Was the food hot and delivered on time? Was the room clean? How is the pre-admission process? What's the post-discharge instructions? So we think we can capture a lot with that indicator. Second area is to provide unparalleled palliative care. We talk about bringing people to health and wholeness, a special focus on the poor and the dying. We want to make sure that Bon Secours is the best in the country at providing palliative care services. So one of the measurements, we'll do a lot of work to understand what we do well currently, what's going on around the country, what are some new innovative thoughts around palliative care, and we want to make sure by the end of this, hopefully sooner, by the end of this period with our SQP, that every local system adopts that best practice for palliative care.
Next week, Rich talks about transforming our health delivery. Well, that's it for this week. Stay tuned to this portal for future up-to-the-minute information on these and other stories on BSN Headline News. I'm Dave Schlachter. Thanks for joining us. BSN Headline News is a production of Bon Secours Productions and is solely responsible for its content.